guys, my name is KP Balan. As some of you guys know me as a clinical tutor, I'm also a resident medical officer here in Perth. So some of you guys know me, I'm also an international medical graduate who did my studies in India. I did my basic degree in South India, and then I came over here, did my AMC Part 1, and then did a bit of observership, and then did AMC Part 2. Now, I've talked about this a little bit about my journey in my past video. So today, as one of you guys asked me about the observership, I thought I'd go on and talk about how I attained an observership, and also why is it important to have an observership or not, and where would it be the best to have an observership? Hospital, GP setting, what benefits you the most? So that's what we're going to talk about today, all right? So, observership. What is observership? Observership is nothing but it's where you follow a consultant or someone who has a medical registration under general registration and has the authority to supervise you, and you basically observe what's done in a hospital and what can be done. You really don't have any hands-on clinical experience, all right? So you have two settings that you can do the observership in. One is the hospital and one is a GP clinic. Now, it depends on what's available out there and who you know, okay? That goes a long way. Now, before we get into which one benefits the most and what I found helpful, let's talk about why do we need observership? Can we skip the entire process? Well, you can, but I think it is quite vital. So, I did my observership in between AMC Part 1 and AMC Part 2. Why? Because I really had no idea about the Australian system, especially psychiatry. AMC Part 2 especially had a lot of psychiatry cases, and that really made me very jittery and very unprepared for the exam. So I did know someone that worked in one of the hospitals for psychiatry, and I basically hit them up and asked them if you can arrange an observership for me. And that worked out. I did for 1 month, went back to study for my AMC Clinical 2, and then I went back because I enjoyed it so much, and also I wanted to keep touch with the Australian side of things, how they practice medicine, learn a bit more about the medical system. So, ideally, I would advise everyone to do the observership between AMC Part 1 and 2. One, because you can structure your times in a way that you can do the studying and also in a free time go for the clinical sessions, and that will also help you see the cases and pique interest in you studying for the clinical exam. So that's what happened to me with the psychiatry especially. And AMC, doing it in between AMC Part 1 and AMC Part 2, it was really helpful for me to know what do they mean by multidisciplinary team approach, and what do they mean by social services, what do they mean by the Connect group and the ACAT team, Silver Chain, when did they play a role in it? And also I had hands-on to the drug charts where I could practice a couple of the drug charts on my free time, the fluid resuscitation charts, look at what an asthma action plan looked like in a general medicine ward, and things like that. So you're getting the gist of things. So I would advise you to do it in between AMC Part 1 and AMC Part 2. So what are the perks of doing an observership? One, you get to not only gain insight into the Australian medical system and what can you do, and kind of gives you leverage when you start working. It also is really good in terms of making connections, getting to know a doctor, maybe putting a word in for you in that hospital once you have passed AMC Part 2, or with the limited registration. 3, it is very good because I personally used my consultant as a referee because I had done an exchange program in Australia, and so I had 2 referees from there, 1 to 2 referees from the same clinic, but I needed some diversity, so I used my observership coordinator to be my referee. So they value at least 2 referees from Australia and 1 from back home where you had a clinical experience from back home. So that is usually how the HR department works in terms of your referees and when you first start your job. So that is why observership is important. But apart from that, it has no clinical significance in terms of recency of practice. So I know a lot of people out there saying, oh, I did observership, so my recency of practice is corrected. And I know there's a lot of misconceptions out there. But guys, get in mind that observership does not count for recency in practice, all right? So that's very important. And apart from that, observership in GP or hospitals. I personally suggest I know if you, even if your end goal is to become a GP, I've done GP and hospital. But remember, I did my GP in a rural area, so it was a little different. I would personally advise you to do a observership in a hospital because that is where you get a diverse cases. You actually see how the local communities and how the people function, and it is very important for you to engage with that, and also to find out what about more about the public services that the hospital can get in touch with to help the patient out. And along the line, you'll definitely get in touch with GP. But I think hospital, in my opinion, I'm not trying to offend anyone out there, but that's just my opinion. But if you wish to do GP, go ahead with the GP. That is also very good because you get at least a foot into the hospital situation or the Australian medical situation, and you will know a bit of the guideline and how to manage people. Now, apart from that, how did I attain the observership? Basically, the only way to do that is personally going to the hospitals and asking the departments themselves, the head of the department itself, is there a chance for me to attain observership here? It is not done by HR, and they have no idea about this, and the head of the department has to prove it as well. So if you have heard from your friends and family members that say that, oh, you could do an observership in this hospital, go right ahead and approach them. Okay, there'll be certain departments that take in a lot more, such as psychiatry, internal medicine, and renal, pulmonary, surgical, not so much. All right. And apart from that, other than that, if you know someone who works in the hospital, such as in a consultant position, that would really go a long way. Tell them to put in a word for you and get an observership for you. That would help. So those are my advice for you about observership. If you have any further questions, drop in the comment below, and I'm more than happy to answer your questions. And guys, thank you again for following me and tagging all those people that have questions as well. And keep doing so. And I'd love to see more questions from you guys. Bye.